welcome to the second episode of our video series. This is Denise Nugent, known as Dr. Denise.
And this is Dr. D, and we both practice family medicine. So we're here to help explain things for you, and as always, please do not take this as personal advice for any of you, but just use this to increase your medical education and help your understanding of various things. And the various thing today is going to be
Cold and flu season.
Okay, good. Go.
All right, so here we are in the fall of 2018. Last year was the worst cold and flu season I had ever seen in the last 14 years. And the CDC is predicting that this year is going to be worse than last year.
That's right. I remember last year when I first started seeing it in December, because I was away for a while and I came back in December, and it was like, oh my goodness, bring out your dead.
It was pretty severe. It was pretty severe, and it seemed like it wouldn't end. Usually by the end of March, we've just about finished, and then we just have a few stragglers, and we had another wave.
Right.
It went on till May, and I saw a few cases even in June. So they are talking about it starting to become a year-round problem, but with seasons, because of the way people travel so much.
Oh gosh. So
one of the things that I know we both work on a lot is persuading patients why it would be a good idea to have a flu shot. Do you have very much trouble with your patients getting their flu shots?
This year I'm having less trouble. In prior years I've had to talk to them about, last year's didn't work that well, or something like this, or I've never been sick before, so I'm not going to be sick again, or something like that. But this year, I walk in the room, the nurses said, we're going to get your flu shot ready for you, and people are saying yes. So I'm hoping that continues.
I hope so, because really it is so safe. The flu vaccine we've been using for the last several years does not have any virus particles in it. There aren't dead particles, weak particles, or anything like that. The manufacturers make copies of what's called a capsid, which is a covering on the virus, and they make lots of copies of this capsid. Then that's what goes into your arm, and over about 14 days you make your own immunity. So the beauty of that is, first of all, you don't get sick, so we can give this to babies, pregnant women, to people who are immunocompromised, but also you make your own immunity. So if the virus doesn't change very much, you could have your own immunity for several years.
Right, good, yeah. And this year I understand we're also throwing out that whole idea of being careful if you're allergic to eggs.
Right, there's no preservative in the way they're made now. There's really not a problem with allergies now.
So even if you have bad reactions to eggs, you can still take a flu shot.
You can still have the flu shot. So there are some objections. So you mentioned a couple of them. So what do you say if a patient says, oh, well, I never get sick?
Well, what do you say? If I see a young, strong person who's saying that, I might not spend too much time on that. I have to tell you, I've been bashing my head against the wall on this for years, and I have to admit, it gets sore.
It gets wearying sometimes, yeah. Right.
So if you have a young, strong person who's in the population who is likely to do better if they do get it, then I don't spend a lot of time. If I get an elderly person who has several kinds of illnesses, or if a mom is making this choice for a small baby, then I try to use a little bit of persuasive power, a little bit of factual,
I like to respond to their concerns, find out what it is that they're concerned about, and see if I can help.
Right, that's a good way to do it. See why.
And it's not that I think we need to have every vaccination that's ever been invented. There are different vaccines that are useful in certain circumstances, but we don't all need every single vaccination. I don't need typhus, for instance, or things like that. But the flu potentially can cause severe complications, and the most important one is pneumonia. And even if the person themselves is not afraid of getting pneumonia, I still worry about the people that they could spread it to, and those people could be children, elderly people, immunocompromised people, other people. And I think anyone would hate the thought that they started their own little epidemic and caused a classroom or a workplace to get sick because of them, and what might happen.
That's true. We're not just immunizing a person, we're trying to immunize the herd.
Yes, as it were.
Yes, they call it
Herd immunity.
Yeah.
Yes, I don't know where we got that one, but yes, I know, doesn't sound very complimentary. Yes. I also have patients who worry about getting sick, but as I was saying, now we just really don't have to worry about that anymore. What about people say, oh, well, it's not very effective?
Oh, I think for each individual person, it's probably impossible to measure how effective it is.
We can't tell ahead of time.
But we can certainly, on a large scale of many people, tell them how many fewer deaths there are, than there.
We can. They keep track. So in Southern California, we can see for Orange County, San Diego County, how many deaths there are, how many hospitalizations there are for pneumonia, how many complications there are, things like that. Yeah, so it has a big impact.
Right. And you might possibly get the flu even if you have a flu shot, but then we would normally expect it to be a less severe case.
Right, and what we really want to do is avoid the complication, and that's the pneumonia or something else.
Right.
Happening like that. I also hear people say, well, I want to build up my own immunity. Well, I don't know if I would wish that on my family. Yes, if they get sick, they will build up their own immunity, but you can build up your immunity also because with this kind of an injection, you are making your own immunity.
Right.
So I don't think
Right.
I really don't think it's the same issue as it used to be.
It's a matter of understanding, yeah.
Mm-hmm.
And people tell me that I got the shot on such and such a year, and then I got the flu. I got the flu right away, and
Yeah.
it was a really bad flu, and I got it the next day, and things like that. And as far as our information that we are taught, this just doesn't happen. I mean, you could in past the flu shots may have given a couple of days of mild symptoms,
right.
mild symptoms, but that's the kind of thing it can give, or it could give at that time.
Right.
But you have to understand that you get the flu shot on day one, it's not going to be effective for you for 14 days.
Right.
And you are part of this big herd that we're immunizing.
Yeah.
We're immunizing 400,000 people here, and a number of them, a large number of them, are going to get the flu the day after they get the shot.
Right.
And that could be you,
Statistically.
statistically. And you are not, you haven't built up your immunity yet.
Right.
So you get the shot, you happen to get the flu in the next couple of days, and the next week or something, and you haven't built up your immunity yet. So yeah, you're gonna get a
Exactly.
case of the flu.
Yeah. So, so cold and flu season starts. A lot of patients come in telling you that they have the flu, but do they have the flu?
Yeah. So what's the main thing for the flu that I'm looking for is fever and chills.
Yes.
And the fever and chills lasting more than just an evening, like it does for
Like for a cold. I agree.
Okay, fever and chills, body aches, feeling like somebody ran over them with a truck. So this is typical of influenza.
Yeah, I have to agree because it really is attacking the whole body. It's not like a cold from the neck up.
Right. So that's right. That's a cold virus is going to be mainly attacking this part of the body, and the influenza is attacking the whole body. And it does, just like a cold, though, it's going to start with sore throat and fever, and move on to runny nose and cough. It's more likely to have, if you're coughing up some phlegm, it's more likely to be clear or white, although everybody gets green stuff in the mornings. So,
Right, stagnant mucus.
Right, if you're laying there all night, your upper bronchial tubes are where everything's collecting and pooling and gaining in thickness and color and all kinds of awful stuff like that.
Yeah, that sounds truly gross. Yes, it is, but it is. That's what it is. It's stagnant mucus, and we used to think that meant that someone was developing a bacterial infection and that antibiotics would be useful. They've done a lot of studies on this, mainly on volunteer medical students, and found that this greenish yellowish mucus usually is just stagnant mucus, and that antibiotics aren't actually going to help.
Right. So I ask people, is that mainly in the morning that you get that? Do you get this green stuff up, and then after your shower, which is great, by the way, it's great therapeutically.
Yes.
Because it's steam and it gets through all your sinuses and all your bronchial tubes, and then you cough up and blow your nose. And I say, now the rest of the day, do you get the green stuff the rest of the day? And so that's a significant question.
Right. All right. So we just compared colds and the flu, and there can be atypical cases too. Last year I saw a few people who had been vaccinated, and so they had milder cases, so they weren't sure at first if they had the flu. So sometimes it is a little difficult to tell, and if you have a question, of course you can go see your doctor about it. Next, I suppose, comes one of the things that we really don't like, and that's when people want antibiotics for the flu. I hate saying no to people all season. Yes. Yeah.
Well, for years and years, people knew that if you have the flu, that it's lots of fluids, get to bed. They have this mental picture of the ice pack on the head, and they know that they're going to be sick and get over it that way. But people, especially in our area, got to get back to work. I got to do this. I got to do that. And so they'll either be saying antibiotics, or if they're educated that that doesn't work with the flu, then they'll be saying, I want the Tamiflu. And really, it's really not necessary unless, again, elderly or young. We're using it more and more.
Right. I've definitely used it for teachers or family members who know that other members are immunocompromised. So that's, it's a good use of it. They usually do need to take it starting within 3 days of the illness beginning, or else it's not going to do very much. Occasionally I have heard it used after 5 days, but I think that's a desperation measure. I just don't think it's going to be nearly as effective.
Yeah, so if you come in after 5 days or after 4 or 5 days, probably not much use in starting Tamiflu.
The flu truly is a miserable thing to have. There are people who will come in, I have a cold, my head hurts so much. But it's not the flu if you feel like you're kind of sick from here up. It probably is not the flu, even if you do feel crummy.
So wonderful things that can help you with the flu, in addition to anti-infectives, antiviral, are steam. It's like my favorite thing, because even the people that wash their sinuses out with water,
like saline,
that only goes so far. The steam gets in all the little crevices, so I love it. It loosens things. And if your head's full of stuff, your chest is full of stuff, you want it to be loose. You don't want to get it thicker or drier.
Right.
So I'm kind of a little anti-decongestant, to tell you the truth.
I've changed, and I don't use it at the beginning of illnesses now.
Yeah. So I I like to see people use anything that will make it flow better. So Mucinex plain is a good thing. Mucinex is guaifenesin. It is an expectorant. That means it's going to help you spit better. So it's going to loosen things. Plain Mucinex. Don't get the one with the D, because that's the decongestant. And I don't like all these things with all kinds of different medicines.
The medications that have 6 ingredients in them, and
you're
trying to sort out
XYZ severe or something like that. People don't really know what's in them. So you should just know 3 things, okay? Decongestants, dry things up, so they're not bad for allergies where you're going drip, 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 and it's drip, drip down the back of your throat when you're trying to talk to people. That decongestants dry up. Expectorants, like guaifenesin, loosen things. And then we've got the cough suppressant.
So that you can rest.
Right. So those are the 3 things, and you have to figure out what you need amongst those. I kind of lean towards expectorant myself. So the magic thing for flu, also for sinusitis, guaifenesin, steam, And if you can take it on your stomach, if you're not allergic, ibuprofen. Because ibuprofen will help your muscles feel better, help your fever come down.
Yes.
They can actually, if you take some regularly for a few days, it will actually take some inflammation out of your sinuses if you have sinusitis.
Oh, I agree. It's great for taking pressure off of sinuses, helping them to drain, and just making you less miserable while you wait it out. It works.
And rest. You know, it's
Yes.
today people are saying, I have to be at such and such. I have to do this trip. I have to go to work tomorrow. I'm so sorry that you do, you know, and I respect it, but try to respect your body as well. That your body's not going to take any
It's the
excuses.
old, if we can put a man on the moon, why can't we cure the common cold? And we cannot. And so people are contagious, especially the first week that they have a virus. They're usually less contagious the second week, though some people have lingering abilities to be contagious. Some people can catch the flu or at least be exposed and be carrying it and not come down completely sick, and they can pass it around. So I really think being considerate of our coworkers is something we need to think about. You know, people should not go to work if they had a fever the day before. They should really wait until they've had 24 to 72 hours without a fever. You have to decide what's right for you, and you can talk to your doctor about it. But in general, I think you need to go at least 24 hours without a fever before you start thinking you can go back to the classroom and back to work.
And hand washing.
In flu season, it really makes a difference.
Huge
Yes.
difference. Huge difference. So I can be at work all day long. I can see 25 patients, and I can see 12 of them have influenza, and I touch them,
Yeah.
and I don't get it because I wash my hands after every single patient with soap and water. So, you know, do that at home.
Yes, I wash with hand sanitizer or with soap and water. Yes, and before and after the end of the day,
And
because
be,
I've been exposed to a lot of people.
and be aware of what you've touched. You know, if you've touched
Doorknobs
or whatever,
counters.
you don't want to be touching your face. If
computers.
you're the one that's sick and you've touched your face, you don't want to be touching people that you don't want to give it to. You want to, when we're at work and we've got a little bit of a cold or something. Whenever I'm so aware of when I've touched my face, or especially if you go and blow your nose or
Yes, I
something.
go to wash
you
my
have
hands
to
right
wash
away.
Your hands right away.
I wash down the keyboard, the mouse, everything I've touched. Yep, that's right.
And it keeps us well. It works.
So it's going to be a bad flu season, but we can be prepared for it. And your doctor is one of your best allies. Of course I would say that. Thanks for listening.
Thanks for listening.